there's a lot of literature to prove that.
I agree. All right, let me start with this. Well, I'm sorry. This is my meeting. These people have questions. I'll be glad to listen to you. If you have a question, I'll be glad to answer. But this is not for you to come here and espouse your beliefs. Because I agree with most of what you're saying. But if you have a question, I'd like to address the question, and then we'll move on to somebody else's question.
Okay. What are you going to do about the czars?
Well,
they're not in the Constitution. They're not.
I agree. There are 34 czars in the government today. We have had amendments to try to limit the number of czars and to defund the ones that came up in specific bills. For example, the Labor, Health, and Human Services bill, we tried to defund all the czars that are covered in that legislation. It was in the Appropriations Committee. It was by a party line vote where every Republican voted to eliminate the czars and every Democrat voted to sustain the czars. And I'm very disturbed by having them there because they do have authority through the regulatory process, but they have not been confirmed. They are not part of our nation's laws, and they are outside the realm of what we consider to be good governing. For example, the car czar is now running General Motors. I don't think they should have a car czar. I don't think we should be owning General Motors at all. Well, we're trying to defund them, but let me tell you, elections have consequences. Elections have consequences. A lot of people in this room here stayed home last year. And across the nation, a lot of people stayed home because they were upset about something that was going on, either it was Iraq or George Bush or something, and we got the government that we have. Elections have consequences, but I believe that 2010 is going to be a very good year. And I bet you everybody in this room is going to be registered to elect. You're absolutely right. We have to control the borders. Every nation is defined by its borders, and we need to define our nation. And as it's tied to this bill, that I'm not going to vote for, by the way, and this chart, we hear about the uninsured in America. Let me tell you who they are. About a third of the uninsured are people who do not want to pay for the insurance. They make the choice. They feel like they're made out of Inconel steel. And they're undamageable, and they don't want insurance at this point in life. Most of them are young. Most of them are young men, and they don't have much need for health care. Another third are people that are actually transitioning between jobs. They had insurance, and they're just waiting to qualify for the next insurance as they change employers. The last third of that group is illegal immigrants. And the question is, do we want to pay for their insurance or not? This bill pays for it. This bill has a non-discrimination charge in it that they can't be ignored. I agree. It should be only American citizens. I agree. Yes, sir.
What has me worried is when the Homeland Security Department came down and said anybody who's pro-life, pro-gun, believes in states' rights, or is a returning vet from Afghanistan or Iraq is a right-wing extremist and a potential terrorist. That kind of talk scares me. I think we have a federal government that's going out of control, and we better do something to rein them in. Now, what are you going to do about that?
A government that can give you everything can also take everything away. And the problem with our government today is that it's getting too large and too intrusive, not only into our pocketbooks, but into the everyday way we live our lives. And the healthcare system is a good example. What we're trying to do that is protect the rights of individual citizens. In 2003, I had an amendment called, it was referred to as the Tiahrt Amendment. There are many Tiahrt amendments, but this one was in the Commerce, Justice, and State Bill. It protected the privacy of every firearm owner in America. 2003 until this fall, or this spring, excuse me, in April, I would get a negative piece of literature in some publication somewhere in the English-speaking world. It was not bad enough that Mayor Bloomberg, who opposed the Tiahrt Amendment, hired a billboard and drove it around Wichita here saying that Todd was responsible for the death of police officers because of the Tiahrt Amendment. He also did that in Washington, but he set up the Mayors Against Guns group. He funded a lot of things. You know, here's a guy that makes $1 million a day. He's got money to burn, I guess. But this year, the Attorney General of the United States of America, Attorney General Holder, criticized the Tiahrt Amendment and said it needed to be repealed. So I wrote him a letter and said, apparently you haven't read the Tiahrt Amendment, because the things that he said it did were actually protected. You know, that we protect police officers that are undercover, we protect the privacy of every American that owns a firearm, And we allowed, whenever there was a crime, we allowed that information to be used in the court so that we could get criminals off the street. He actually read the bill. He then came back and wanted to change one phrase to make sure that international law enforcement had access to it, which it does say in the bill, but he wanted to have a redundant part. And now the Obama administration has endorsed the Tiahrt Amendment. So they finally read it. So I do see some hope in protecting our rights. But I have to tell you, it's up to every generation to protect the freedoms that we have and love. And one of the reasons that this bill is so upsetting to me is it takes away the choice of a patient on which doctor they want. I will fight so that patients get a choice to their doctor. A lady came to my office this year. She was from Overland Park. Her name was Jenny Jo, and she was suffering from an immune deficiency. She was getting successful treatment from the doctor that she had selected until she turned 65. When she went in to get reimbursed for the medication that her doctor had put on, and it worked very good, you know, when immune deficiency, you get a cold and you're in trouble. She was living a normal life, playing with her grandchildren, shopping, until she turned 65. She went in to get reimbursement for that pharmaceutical, and Medicare denied her that treatment. They said, oh, we've got something else. She thought it was a generic, so she went on it. It started with headaches. Then she got muscle pain, mostly in her back, and she caught a violent flu. She had a mask on her face when she came to see me, and she didn't want to shake my hand. She said, you know, Todd, you shake a lot of hands. And she's right. But she was denied the health care that worked for her because it didn't fit the one-size-all plan that Medicare has. This actually reduces some of the selections that are already in Medicare. That's why one of the reasons I oppose the plan. Thank you for the question. Yes, sir.
I've kind of got a three-part deal, but I'll be very, very quick. Number one, I've been a contributor to your campaign, and I am a big supporter of your campaign.
Thank you.
Number two, I feel like the Republicans and the conservatives are getting a real short rope here, and the media is beating us up, and the liberals are beating us up, and we're not getting any credit for being called right-wing extremist Nazis. We've got to deal with that. The senators and the House of Reps has to speak up for us. They have to be our voice. There's not a single person in this room can get in front of a TV. You guys can't. We need you to do it. Number two, I happen to be on a public board, and we have open meeting laws that are designed by the state and federal government. Under open meeting laws, I don't understand how the Democrats can tell you you can't share that with your employer. That's not fair. You should be allowed to share anything you deem appropriate that the voters need to see. If we're going to play a bait and switch, then we might as well give them the keys. They got them anyway, and that's that. Last but not least, very quickly, it seems to me like the three problems with health care are Medicaid reform, Medicare reform, and the lack of short reform. All three of these decisions have been done by the federal government, not by the citizens. So why don't we cure the problems that you caused, I'm not saying you in particular, but the government has caused, before we say, oh, we want to open a new business.
There are things that we need to do to reform health care. You mentioned Medicare and Medicaid. That is a very good place to start. Medicaid, for example, according to the Government Accountability Office, in the state of New York alone, they estimate there's $18 billion of fraud. That's a lot of money. It will go a long ways towards providing better health care. They also say that in Medicare, there's currently about $10 billion worth of fraud per year. I think, I don't know if that's really a very good estimate or not. But I think the point is that you mentioned tort reform. A lot of people don't realize that in some procedures, as much as 30% of the cost is to conduct what's called defensive medicine. Defensive medicine are procedures that clinics and physicians and hospitals go through. It's almost like a checklist so that they can avoid lawsuits. Now, it's not something that's needed for the injury or the illness. It's something to protect them from going to court. And if they are taken to court, they can say, I did everything humanly possible to try to correct this problem. So, you know, if it's just 10% of the cost of health care in America today, that would be a big step in the right direction by just doing